Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele van Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in again and welcome to episode number 112, MSIF, Past, Present and Future with Baneke and Lydia Makaroff. Join me in getting to know what the Multiple Sclerosis International Federation is doing for us and has been done for us, and what is in there for you. Hello, Lydia. Hello, Per. It's such a pleasure to have you on the show. And before we actually start with the interview, I would love to get an introduction. Per, maybe you, because you just retired, could you briefly introduce yourself to the audience and share a personal hobby or interest that kept you grounded during your time at MSIF?
Yes, I'm Per Baneke. I have been CEO of MSIF for 18 years, and at the end of last year I retired. I worked all my life in human rights and refugees before I started work on MS. My father had MS, so it's very close to my heart, my job. And I grew up in Amsterdam, but I've lived for 40 years in and around London. So I consider myself a Dutch Londoner. And what keeps me grounded, I think, is my children, my family, and cycling. I love cycling. I live in a beautiful area. And now that I'm retired, I have even more time for that.
That's great. I love cycling myself a lot. And people can't see it, but there's a lovely picture with like at least 3 bicycles, I would say, more or less, on top of each other. Looks very good. So, Lydia, congratulations on your new role. Can you tell us a bit about your background and what personally motivates you to lead the MSIF?
Certainly, and thank you. It's a pleasure to be here. So I grew up in Australia and then spent some time in America and Belgium before coming here. And I really learned that international collaboration is the key to really doing anything well. I've worked across science, the pharmaceutical industry, and civil society, and I've always focused on public health, human rights, and equity. And I know that MSIF, the Multiple Sclerosis International Federation, is really uniquely positioned to make global change for people affected by MS, which really, really excites me. And I've met so many amazing people affected by and living with MS that and they've been so welcoming me into the movement, and I'm really excited to get started.
Great. Actually, I think Australia is the most preferred country when people leave Germany to go there. So very strange that you left Australia, but of course the other countries are lovely as well, and it's always great to go somewhere. Okay, let's talk a little bit about the mission of MSIF. Per, looking back, what do you see as the core mission and the biggest achievements of MSIF during your time as CEO?
Yeah, that's a good question. Well, MSIF, as Lydia said, is there to bring the world together, to improve the quality of life of people living with MS. And bringing the world together, that means all the MS organizations, that means helping to bring the research community and the medical community together. And of course, people living with MS and their friends and family and around it. So bringing people together is really crucial, and do that globally. So that nobody is left behind, no country is left behind. A very difficult task, but that means that bringing people together in research, and it's fantastic to see how much collaboration there is and how that's grown over the years. But also bringing information together from all around the world so that everybody can benefit from that. bringing information together, data, so the Atlas of MS, which we do, which tells where how many people with MS there are and in which countries, and their different backgrounds. So it's all about bringing people together and supporting people where there is less support. So in terms of achievements, yeah, that's over time in 18 years. I mean, I'd never dreamt that World MS Day would be as large as it is now. I mean, it really is a truly global event, and you see all kind of countries where I don't know. I think it's in 120 countries every year.
Wow.
I think achievements in research. Now we don't do research as MSIF. We are there to be a catalyst. One of the big things I think is as a catalyst to put progressive MS on the agenda with the International Progressive MS Alliance, which we helped build with those member organizations that fund a lot of research. I think for everybody in many countries, getting access to medicines is a struggle. And for some, it ruins them financially. So I work to get access for MS, and particularly the World Health Organization essential medicine list to get MS medicines on that list. That's, I think, one of the large achievements of MSIF with its members altogether. And that means this list means that in theory, at least, every country should have those drugs that are on that list. And there were no MS drugs on that list until 2 years ago.
Yeah. Yeah, that was really a great achievement, and I applauded for your achievements there. And the Progressive Alliance is also so important. I always feel very sorry for the people with progressive MS, aggressive progressive MS, where there is not so much medication or treatments available as of now.
Yeah.
And yes, of course, living in Germany, getting medications is not an issue, but there are so many countries where that's not the case. So thank you very much for all that progress that happens there. Lydia, from your perspective, how do you envision the MSIF's mission evolving in the coming years?
Well, I'm incredibly lucky to be building across the foundation of Pia's legacy of 17 years, including the Essential Medicines List, including the Progressive MS Alliance, World MS Day, the Atlas of MS. We've got so many tools and collaborations that we will keep on building upon. But I think we can see that the world around us is shifting, and we do need to shift too, while still making sure that our mission stays the same, which is bringing the world together to improve life with MS. But we're seeing more and more people diagnosed with MS in countries where the health system isn't ready for them. We're also seeing people who have been living with MS for decades, struggling with housing, employment, and loneliness. So we need to make sure that our tools and resources work for everyone in all countries around the world, no matter where everyone lives. And not only looking at the treatments, the pharmaceutical treatments and the rehabilitation, but remembering that people with MS are whole people, and there's so many aspects of our lives that MS affects, and we need to advocate for living well with MS in all aspects of our lives.
Yeah. Great. Sounds good. Pierre, you already mentioned a lot of initiatives. Are there any more you want to highlight, one or two, or projects that you feel had a particular big global impact for people living with MS? Or
I think that the Atlas of MS has been a really important tool that has indirectly had an impact, because it's the core data for many researchers to know, in fact, where MS is, which people have it, how many women have MS compared to men. Are there differences in different countries? That has really been one of the big successes, and that's why we keep repeating it, and we keep learning about how to improve that and make that information available. It also is a tool for our member organizations. So MSIF in itself is nothing. It's the member organizations, the national organizations, that can influence their countries and their governments. So they are the ones who are making use of our tools and then influence their government. So that's where I think the Atlas of MS, for example, and other such tools of information have been really important. The other thing that I mentioned, and that is very important, Lydia has mentioned a whole range of aspects of life that get influenced by MS. So what we are doing is trying to make sure that the information produced by our member organizations about employment, about becoming older with MS, um, sexual relations, all these things. There is a wealth of information that's produced, and so we try to share that with our members. And on our website, we have a hub, a resource hub, where those kind of resources can be found, and those are the best in the world. So it's that sharing of information and sharing of methodology, but really. It may sound humdrum, but that's one of the biggest achievements I think that we continue to pursue.
Yes, absolutely. And I used it myself quite often. And I just used it for my master thesis about education via podcast, for the German podcast. Okay, but yes, I always check on the Atlas of MS, and I'm wondering how much it will change when, let's say, countries who are not so much focused on MS might be changing in numbers in the upcoming years, because I think there's still quite some bias due to the fact that these poorer countries maybe don't have so much money, focus, time to concentrate on diseases like MS, where there are, let's say, bigger issues. But hopefully in the future they will be able to do that. Lydia, collaboration is essential. How does MSIF work with governments, patient organizations, and healthcare providers to create meaningful change?
Yes, you're right that our strongest work always comes with deep partnerships, and it always starts with listening and learning. So we never just parachute into a country and tell them what they need, or tell a government what should be done. We ask, what do you need, and what would help. We listen and we try to find solutions that benefit everyone. So, for example, in India, we collaborated very closely with the MS Society of India to gather data directly with people with MS, and then turn that into a powerful tool to work with the greater healthcare community, to have strong conversations about MS at the national level. And then we also helped sort of movement building and organizational development within India at the same time. But this was always led, it's always led by the country, and it's always led by the people living with MS in that country, because they are the experts in what it's like to live with the disease in their country and what they need.
Okay, yeah. And there are quite some listeners from India on my podcast, so I can always see the countries, and sometimes I'm like, oh, okay, yeah, interesting. But India is one of the bigger ones. Of course, they have the biggest country by persons, right, as of now. Per, what were some of the biggest barriers MSIF helped to tackle when it comes to access to treatment and care?
Um, yes, well, the barriers is of course the cost. I mean, apart from the research, I mean, you need to have the medicines, um, but in terms of access to medicines, it's the cost. It also is to some extent the methodology. So for example, a pill is much easier to use in many countries. You don't need to refrigerate them, for example, and that's a real problem with some of the MS drugs. The other thing is that some of the MS drugs need great aftercare, checking, etc. It is not available everywhere. So one of the big barriers is cost, the healthcare systems, but also diagnosis. Diagnosis is really the first step to get access. And as you said, in many countries, the diagnosis isn't very good. I mean, there aren't the MRI scanners, or they are too far away. There are many countries where there are hardly any MS specialists, where there are hardly any neurologists. So those are some of the big barriers which we're still working on, and that's why we've put diagnosis very central in the strategy for the next years. And Lydia is the expert on that. We wrote it in the strategy, but so we've started on it. But Lydia, that's one of her key things, I think, in the future strategy. And all these barriers, yes, we've made a step, for example, with the essential medicine list, but it is then up to the individual countries to persuade their government to really make those drugs available and to pay for them. And that means that there is still a big challenge to support member organizations in many countries around the world to pursue that goal.
Yeah, and there's research again important because they need to understand if we patients can work longer, to put it just very easily, then we pay taxes, and that might be way more cost efficient than don't caring about us. So, but of course, yeah, you help on that side as well. So, Lydia, today, what do you see as the biggest ongoing challenges for access to MS treatments globally, especially in low-resource countries?
Yes, so access to treatments is a huge issue and it's still incredibly unequal. We found that 70% of MS therapies are used in just 30 countries. In many parts of the world, as Pira said, even getting diagnosed is a challenge. So we need to work at so many different levels. And one is really working with the World Health Assembly as well and the World Health Organization to make sure that MS and other neurological conditions are on the agenda, that countries are paying attention, that they remember that there are many people living with neurological conditions in their country. And as you have said, if we can make sure that people with MS and other neurological conditions have access to cost-effective treatments, then that's going to benefit the entire society and the entire country. And it's actually in the interests of governments and the interests of health systems to make sure that people have access to cost-effective treatments because the countries are going to save money in the long run. People with MS and their families are going to be living happier, healthier lives, and I think it's a win for everyone.
Absolutely. Yes. And our kids are very good in soft skills, I always say, because they know that we have to live with some not so easy conditions, and so their soft skills are good. So we are helping society in different ways. Uh, That's something I always like to point out. So, what strategies or program does MSIF employ to improve access to rehabilitation services for MS patients globally? Because that's important as well. You can't prevent everything, but that makes rehabilitation very important as well.
Yes, absolutely. So, one way that we support better rehabilitation is through visibility by putting it on the map. We included a survey of rehabilitation in the Atlas of MS and found that rehabilitation was often unavailable or inaccessible, especially outside urban centres. And since then, we've seen MS organisations use that data to advocate for expanded services. We also help share what works. So last week, I went to visit MS Ireland in the Republic of Ireland. And I interviewed their chief executive about their virtual rehabilitation service, where they run online classes for rehabilitation, which are specifically tailored to the type of rehabilitation challenges that particular people need, whether so they can have different classes for wheelchair users or ambulatory people, older people, younger people. So not only are people getting a much more tailored class, but no matter where they're living, they can also access this class and they don't have to worry about travel or accommodation or time spent as well. So, or energy. Getting to and from the rehabilitation center. So it's also sharing sharing best practices and promising practices so other MS organizations from around the world can learn from what works.
Great. Sounds very good. Yes, and that's very important in many countries. Not everybody lives in a big city with access to good rehabilitation care. Per, how did MSIF integrate the voices of people living with MS into decision making during your leadership?
Yes, well, it's interesting because if you look back, I don't know, 40 years, there was nobody with MS on the MSIF board. It's really interesting how life has changed, and crucial how the perspective has changed. Um, and so the main there are two things. One thing is, of course, with the internet and computers, not everybody have them, but we can consult much more. We can do surveys and things like that, and also in research. So we really have with our members more and more that you got to have people with MS who play a role early on in deciding which direction do you go with your research, what research do you fund. So many of our member organizations are research funding organizations. They do research, but they can be very strategic by how they direct their money to which researchers and stimulate international collaboration in that. And you need to have the voice of people with MS. What is important for you? What is your experience of life? Um, so in research, and you see it also in the research institutes more and more. They see that's important. But apart from that, we've made sure that in our board, in all our working groups, in all our committees, we have people with MS in there to and they cannot. I mean, people with MS are so different, of course. They say it's the disease with 1,000 faces, so it's different. So it's very difficult as one person with MS to you can't represent that, but at least you give that perspective and you call for attention to it. We also have a separate committee with people living with MS from around the world that comments on many of the things we do. So if we want a quick consultation, then that's the people we ask. Um, yeah, but there is a lot more to be done there. Actually, there is a lot more to be done, and there are many barriers for it as well.
Yeah, yeah, and sometimes it's conservative doctors as well. When they are afraid of losing their position of the God in white. We had that at least in Germany. I have many doctors in my family, so I have nothing against doctors. I like them, but yeah, thinking about 40 years ago, there was no patient in the decision-making process is really awkward for me. But I totally see that, and it's great what has already been done so far. And for you out there, if you want to become an patient expert, there is, for example, one thing called UPATI, which I'm doing right now and will be finishing in October, where people with all different kind of conditions all around the world. It was started by the EU, but in my group there are people from North America, from Asia, from Australia, and people learn how clinical trials and stuff are happening, and then can take part in that as patient experts. So that's a good one. Lydia, mental health is also a critical one in MS. How is MSIF working today to support emotional well-being and resilience for patients and their families?
Can I just say I'm so pleased to hear that you're involved in UPATI as well. I'm often a guest speaker at the UPATI Academy, and I see so many fantastic patient advocates coming through that academy and really just changing the healthcare system across the world with the skills that they've learned. So it's a really inspiring and incredible community, and I'm so glad that you'll be part of it. So on to mental health. Yes, as you know personally, living with MS just isn't about managing physical symptoms. It's about how people feel, how they cope, and how they're connected. And at the heart of my work and MSIF's work is supporting emotional well-being and resilience. And one thing that I'm very proud to have seen launched, which started when Pia was chief executive, was our wellness practice and complementary therapies guide. So this gives people practical, trustworthy information about what they can do alongside their medical treatments to feel better emotionally and physically. So there are some good wellness practices that have good evidence behind them, such as exercise, gentle walking and stretching, which can lift mood and anxiety. Relaxation techniques like deep breathing and mindfulness can reduce stress, and eating a healthy, balanced diet can help as well, although we know that there's no magic foods or superfoods. But if we eat a healthy, balanced diet, we can feel more in control of our health. Um, but we also want to know that people want to try things beyond medication. And sometimes it's really hard to figure out what's safe, what might help, what's dangerous, and what's to avoid. So this guide explains the science. It says where there's real evidence and where there isn't, and where to be cautious. So it goes over 25 different therapies and includes a checklist to help you think through the cost, the safety, and the benefit. It's currently available in English, Spanish, and Arabic, and we developed it in collaboration with our members in Germany, the UK, and Canada. And we're hoping to be able to translate it to more languages as well. And I'm really proud because it's a very useful tool to help people make informed choices and feel more empowered to support their own emotional well-being and resilience.
Fantastic. Yes, and evidence-based is a very key, important thing. I always try to push here that evidence-based information is really important and not eminence-based, where people just think about their experiences, because that can be sometimes wrong. So very great. And with AI, I mean, it's possible even as of today to take maybe the English document or the English checklist and go through it and get an idea. And it should be quite okay-ish. Of course, it's great when you have the translation, but yes, so people could use it as of now. Per, MSIF has been a driver for international MS research collaboration, not directly but indirectly, as you mentioned. Which research milestones are you particularly proud of?
Yes. Well, I think, as I mentioned before, the International Progressive MS Alliance, which is started in well just over 10 years ago, to be a catalyst, really, to draw attention to that there was very little attention, and people with progressive MS felt alone. They didn't see much progress. Um, and so it's a milestone in bringing research funding organizations together with also the pharmaceutical industry in an advisory capacity, and the research community with people with MS, in order to pursue and clarify strategies to tackle progressive MS. Um, and that, I think, is changed, has changed the amount of energy. So the amount of money spent by the alliance, probably 60 million euros over time, and that's still, some of that still has to be spent. But that in itself is not the most important thing. The most important thing is that suddenly all the world conferences of neurologists coming together began to talk more about progressive MS. And so there is still so much to understand, but it is very satisfying when you go to these kind of conferences to see, thousands, literally thousands, 8,000 people milling together with a large emphasis on progressive MS. And that's fantastic. The other one, and of course, yes, there are several drugs in progress, in trials, etc., which focus more on progressive MS, and there are some drugs that work. Is not enough. So there's still a lot of work to be done. The other one is methodology, in fact, patient-reported outcomes. So the measurements that in the past, that okay, you go to the clinic, you get some tests done, etc., but you don't go to the clinic all that often. So to keep track of progress and to see what the real impact of drugs is, that in day-to-day life and also in research is something that's not continuous, and that doesn't necessarily take the opinion or the perspective of people living with MS into account. So, but to take the perspectives and the experience of people with MS into account, has to be done very methodologically. It needs to be repeatable. It needs to be reliable. If you get data from many people, so we set up an initiative to try and develop those methodologies better with researchers from around the world. And it is quite technical, but it is really crucial that the voice of people with MS and their experience gets translated in a scientific way, so that it can be used for research and can be used for treatment. Those are two of the which I think we can be particularly proud of those initiatives.
Absolutely, yes. And we met actually in person at one of the big congresses at ACTRIMS. I remember that. I was already pregnant. I had a little bit of a belly, but yeah, we met at ACTRIMS. And ACTRIMS, I think the one in Milan I think that was the one on smoldering MS, so kind of the progressive MS. Where people started to think about more about all that, the progressive stage. So, Lydia, how will MSIF further support innovation and interdisciplinary research going forward, especially in fields like rehabilitation and social participation?
Yes. So as Pierre has said, one of the one of the most important ways that we're supporting innovation is to look at patient-reported outcome measures. So what is actually important to people with MS? So we're asking, how are you actually doing, and what does progress feel like to you? What do you want? What do you aspire for? And so we want this not just in research, but also in advocacy and care planning, to make sure that people have the right language to speak about how they want better support for cognitive symptoms, for rehabilitation, for beating fatigue and having the energy to get through the day. And then also building upon the International Progressive MS Alliance as well. I'm very excited to be able to be attending their hour face-to-face workshop in June, which is focusing on digital tools as well. So we'll be looking at digital innovations, especially those that incorporate patient-reported outcomes, and how we can scale those up globally, including in places where they're not part yet of routine care. Because as we've heard in this podcast today and in this discussion, if we want meaningful innovation, we need to start with what people living with MS are telling us, because that's where the future lies.
Yeah. For me, it's more important to play with my children than the, I don't know, 500-meter walking distance. But of course, as you just explained, Per, it's important that you can measure it, that you can compare it. So talking with the patients and then bringing it into something measurable. And digital tools are a great one there. So, Per, what advice would you give to national MS organizations, especially smaller ones, to strengthen their advocacy and support efforts? Because maybe some of the listeners are working in one of these organizations or want to bring in their knowledge and their experiences.
Yes. Well, I'd say learn from others. And that's where MSIF, it's a meeting place. I mean, the most important thing we do, in fact, is bringing those organizations together, bringing people together, so they learn from similar countries, different countries, about how you can influence. And then I would say, don't underestimate the influence you can have, and work together nationally. You see, in some countries, particularly federal countries, that the organizations are very organized in their own part of the country. They focus on that, but because of that, they don't go to the national government, and you can have tremendous influence by changing national laws or national policy. And I would also say, pay attention to the global tools that are there from the United Nations, the World Health Organization, Disability Convention, many other essential medicine list. Do make use of those tools. And then, of course, yes, you'll need to have the voice of people with MS, people living with MS, and bring that in and make that useful. And the last thing is very important. Make sure you have the data. Data speaks, so you can persuade politicians if you know how many people with MS there are, if you know about a particular problem, how many people with MS are not in work, are in work. Those kind of The economic cost you talked about, well, that's complicated, but there have been quite a few studies in individual countries about the economic cost of MS for the government and for the people themselves. So have the data.
Yeah. Yeah, and there's also these indirect costs when people have to take care of their relative ones. So it's not just the ones who have MS, but yeah.
Yeah.
Very interesting. I really like the data because it's very powerful, as you just mentioned. Lydia, how does MSIF plan to empower national and regional organizations even more strongly in the future?
Yes, well, I think that we can see that real change begins at the national and regional level. And we know, and I can see that MS organizations that are national and regional, they're closest to the needs of their community. And so our role is to support them to grow stronger, more connected, and more confident in their advocacy and in their support. And some of the ways that MSIF does this is by sharing tools, offering mentoring, offering twinning, creating peer networks, and helping organizations and people learn from one another. We can support MS organizations and individuals to raise awareness, to influence policy, to improve services. And something that I want to see in my tenure as chief executive is to have a dream that no matter where someone lives, that there's a strong, informed, and empowered MS voice representing them.
Sounds great. I like that. Okay, so we are coming to the end. Pierre, if you could share one personal message of hope for people living with MS, what would it be?
In some ways, it is. There will be progress. There will be progress. It is amazing to see the dedication and the energy and the connections of so many researchers around the world, backed up by many MS organizations who try and raise funds for it. So we'll go up and down. Politics will change. Economics will change, but that progress, I don't think, will stop. So the medical care, it will improve over time. It's not quick, but that's the big hope for the future.
Yeah, absolutely. And I try to get some of these, also the young researchers here on my podcast, and they are very impressive people with great ambitions, and it's really lovely to see how many lovely, intelligent, and sophisticated people are doing research because our disease, in a way, is very interesting for them, and it's rewarding because we are young people at the beginning when you get the diagnosis, so you can uh, make so much change when you help people, even if you help just a little step once at a time. Lydia, where can our listeners find more information about MSIF and upcoming initiatives online? I mean, I will put the link in the show notes, but people should hear it at least once.
Thank you. Yes. You can visit msif.org for global updates, practical researches, and stories from the global MS movement. We also share regular content on Instagram and LinkedIn. I'd really encourage your listeners to explore worldmsday.org as well. As you know, it's on the 30th of May each year. 30th of May each year. It's our global day of solidarity and action. And this year's campaign is My MS Diagnosis, which we've talked about today about the need for earlier, faster, and more accurate diagnosis. We've got so many personal stories from people around the world to shine a light on many of the challenges and successes that we've had around the world. And I'd encourage all of your listeners to get involved in taking part in the MS Heart Challenge as well. It's a simple, creative way to share support. We just simply make a heart shape with our hands, with our friends, or even objects around us. We share a video or photo online, and this helps us join thousands of others raising awareness and starting conversations about MS diagnosis. So please remember, whether you're living with MS, supporting someone, or working in healthcare or research, there is a place for you in this movement. You're not alone, and your voice can help make a difference.
Fantastic. Pierre, Lydia, thank you very much for being my guests and for talking about everything great MSIF is doing. And hope to see you at, Pierre, maybe not, but Lydia at one of the upcoming events.
Thank
And
you.
for you, lots of great bicycle, passes. I guess
Thank you
there's
very much. In fact, I'm in 10 minutes. I'll get on my bike, and it's beautiful in sunshine here. So, but I'll follow MSIF and all the people with MS around the world. That is close to my heart.
That's
So I wish everybody good progress and lots of hope.
great. Thank you. Bye-bye.
Thank
Thank you
you
very
so
much,
much.
Nele. Bye.
I hope you enjoyed the interview and are curious now to check out the website of the MSIF and be part of all the great initiatives, be it that you can share what good things they are doing, or maybe even become more actively part in it. So thank you, and remember, stay as active and positive as possible, and see you next time. Bye. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.